Good morning to all of you. So, in my last talk, in nutshell, talked to you about what are thyroid diseases. Is it increased in size or its function is disturbed? So, if it is increased in size, that means it's a goiter, visibly enlarged gland over here, which has been called gillard in Hindi, Punjabi, in our part of the world. Well, अगर size में बड़ा है तो then it can be either cancerous or 90% chances are that it will be a regular iodine deficiency goiter, which is very common. Thyroid becomes bigger. So now it is upon the clinician, the surgical oncologist or the surgeon, to evaluate this enlarged thyroid or goiter and say, is it benign or is it malignant? How do we do that? By clinical examination, we find out, is it a single nodule which has become big, or is it one nodule out of the multiple nodules which is very big? Yes, that's called a dominant nodule or a solitary nodule. So the chances of cancer are far higher in a solitary nodule oblique or a dominant nodule. So what do we do about this? We get an ultrasound done. Ultrasound can fairly reliably tell us that it's likely to be cancer or not. So if it says it's likely to be cancer, then we put in a needle and test that. It's called cytology, fine needle aspiration cytology. People these days call it FNAC. Well, it's FNAC. So in FNAC, the pathologist tells us that it is benign nodule or is it a cancerous nodule, or sometimes they are unable to tell us that it could be malignant, it may not be. So then what is the next step forward? The next step forward is, if there is a suspicion of cancer, then the next step forward is to remove that lobe of the thyroid. There are two lobes of the thyroid, thumb-sized, big each side, but once a cancer occurs or a tumor occurs or enlargement occurs, they are visible. So we remove that side of the thyroid if there's a suspicion. If it is definitely a cancer on the FNAC and on the ultrasound or clinical evaluation, then we may still do one-sided thyroidectomy. That's called a hemithyroidectomy or a lobectomy. Or we do completely remove the thyroid. So one or two things which I'd like to share with you is that thyroid cancer is rather harmless or innocuous cancer if it has happened to come in a patient with a of the age group of 15 to 45. 15 to 45 or 50 these days we call it, they are very harmless cancers. They don't kill. We used to be taught, and I often share with my students also, that if God gives you a verdict that you have to have cancer, you choose which one. Choose thyroid cancer. Thyroid cancer never kills. Particularly between the ages of 15 and 50, it doesn't kill. It's a harmless cancer. So when it's a harmless cancer, we sometimes decide to do only a hemithyroidectomy in a thyroid cancer of this age. Hemi means remove of that lobe only. But beyond these ages, we do a total thyroidectomy. Now, what's the problem about total thyroidectomy? It's a very, very, very careful surgery. There are two very essential other organs which stay hugging the thyroid gland. One is a nerve to the voice, and one is the one of the gland called parathyroid gland, which is responsible for calcium metabolism of the entire body. So if we happen to touch these two structures, then the life is changed. So for a harmless sort of a cancer, we would not want to affect your whole lifetime. Well, with the increasing experience, like I have about 40 years of experience doing this, I fortunately have never had any of these two injuries. None of my patients has ever had these two injuries. But I'll have to confess, it becomes better and better with time. Our surgical skills, a lot of grace of God is required, and a lot of careful treading, careful walk while doing this surgery. very careful movements of the hand, and our gadgets these days, they permit us a bloodless surgery. Not even a drop of blood comes in a thyroidectomy. So when the thyroid is enlarged, I share with you again, summarize, we evaluate, is it cancer, is it non-cancer? If it is cancer proven, then also between 15 to 50 we might just think of doing a hemi, that means half the thyroid removed. And if it is beyond these ages, generally we do a total thyroidectomy, and a total thyroidectomy is a very careful surgery, and if done carefully in able hands, in mature hands which have been trained over the years to do this surgery, it is a daycare sort of a surgery. You can be discharged from the hospital in 1 day's time, or even on the same evening. Thank you very much for listening to me. Hari Ram.